you for being here. I'm here with Mayor Walsh. We'll go over some data and touch on a couple points. Mayor Walsh will give a briefing on some of our economic recovery efforts. Then we'll take some questions. I want to thank the mayor for being here and all the work he's done. I can't ask for a better partner through these unprecedented times than the mayor of the city of Syracuse. Today, unfortunately, we've lost another neighbor to COVID-19. She was in her 70s, underlying health conditions. Again, this is just too tough when you think about this and you put yourself in the shoes of the families. You know, she's sick, she's in the hospital, and she can't be there at the end, and her family can't be with her. So we're thinking about their families. We're grieving with them as a community and remembering them. And our thoughts and prayers are with all those who have lost a loved one and those neighbors that are no longer with us. When we look at our active cases, I'm going to go through the data, then I'm going to explain some of the data. We currently have 724 cases, up from 695 yesterday. This is 29 new cases. We currently have 42 individuals in the hospital. This is down 2. This represents 15% of our active cases. Our hospitalization rates have stabilized and are starting to go down. Positive news. We now have 12 individuals in ICU. This is down, and this now represents 4% of our active cases. At one point, that number was close to 10% of our active cases. So that's positive news related to our infrastructure in the hospitals, our ability to fight this fight. When we look at the 42 individuals who are hospitalized, we have 23 Caucasian, 10 African American, 3 of another race, and 6 folks who we don't have their demographic data on. Today there are 422 people who have recovered. Our green curve, this is up 18 people from yesterday. Very good news. We continue to see recoveries, lots of recoveries each day. Very positive. So looking at our yellow curve, these are our active cases that our health department is monitoring. Our active curve, we now have 279 active cases. This is up from yesterday. We knew that this would be a moving target with our yellow curve as we're doing proactive testing and trying to hunt out the virus in various areas of the community now, and really where we've been going into potential hotspots with the anticipation that we are going to find more positives. We'll go through that data in a minute. We now have 97 individuals in our positive total that are household contacts. So out of our 700 and what do we have, 724? The 724, 97 cases were contacts. They weren't original carriers of COVID. They came into contact with somebody in their home. Think of it that way. Why is that different? That's different because we have already had these individuals in quarantine. We don't need to restart investigations. That is important. And we always anticipated that this would happen. So from a standpoint of investigations and trying to identify new contacts in the community to prevent community spread, these folks are already quarantined. In addition to that, it's less resources on our healthcare department. 16 of our new cases are affiliated with our senior living facilities, and 1 is a new contact. So I want to explain that for a minute. Why is this important in our data? We are proactively looking for these cases now. These cases most likely never would have been caught or reported if we weren't doing what we're doing. These cases are concentrated in certain buildings. So when we look at our overall community's fight with the virus, and we try to demonstrate as community spread, how intense is the community spread? How random are the infectious folks? We need to separate that from where we have individual hotspots in the community. Because hypothetically, we're now going in, we're identifying who's sick, we're quarantining, we're going to get these people better, and in 2 weeks, this problem is put away. Think of it as a building on fire. We're going in, we're fixing the building, we're containing the fire, and then we go on to the next spot. So these cases are not indicative of community spread. So when we look at it, we have 17 affiliated and or contact cases out of the 29. We have 12 cases that are community spread related. Important to note that. I want everybody to really understand that. We now have 860 people in isolation and or quarantine. This number's up from yesterday. Out of the 12, we have 29 new people that are obviously in isolation. Out of the 12, we do our investigations. We find their contacts. We quarantine them. So that number's up a little bit from yesterday. Background on who our positive cases are, some demographic information. 402 are female, 322 are male, 26 are under 19, 138 are in their 20s, 101 are in their 30s, 113 are in their 40s, 127 are in their 50s, 107 are in their 60s, 54 in their 70s, 41 in their 80s, and 17 in their 90s. Percentage of breakdown, again, these percentages are starting to get skewed a little bit because we're going out and we're identifying potential cases and potential risk in our vulnerable communities, specifically in some of our senior facilities. 23% are under 30, 37% are under 40, 52% are under 50, 70% are under 60, and 30% are now over 60 years of age. Breakdown by municipality. City of Syracuse, 328. Town of Clay, 74. Town of Manlius, 50. Town of DeWitt, 40. Town of Salina, 38. Town of Onondaga, 36. Town of Camillus, 33. Town of Cicero, 27. Town of Lysander, 21. Town of Geddes, 20. Town of Pompey, 20. Town of Skaneateles, 14. Town of Marcellus, 4. Town of Tisco, 4. Town of Van Buren, 4. Town of Lafayette, 3. Town of Elbridge, 2. Town of Fabius, 2. Town of Spafford, 2. And Town of Tully, 2. So we've had cases in every end, every town of our county. Certain communities that host certain facilities that we've had high density of cases, their numbers are going to be disproportionately higher than others. What are we looking for? We can explain that when we look at the data. So then when you take that building out of that circumstance, what is the percentages with the rest of the community? Is it in line? If it's not in line, we got to do more digging to try to figure out what's happening and what we can do to be proactive. Testing. There have been 9,186 tests administered, and we've had 159 tests completed yesterday. 8,974 tests have been returned, with 724 positive and 8,250 negative tests. We have 107 pending tests. We've received 212 back since yesterday. Not in these numbers are 383 tests performed at the Walmart site since Monday. We expect to have those back shortly. We'll know the positives. Then, based off of that, we'll know the negatives. Again, many of these 383 tests, proactive testing of employees. So it will be interesting to see if those percentages hold true to the other percentages we've seen, where about 7.8 to 8% of those have been testing positive. Whether that holds true or not, we'll see. A lot of this is proactive now. So again, just to remind individuals, after the positive result, we are going to contact you, our health department, check in on you, check in on your symptoms, see how your health is. At that point, we'll start our investigation into potential direct contacts. Our investigators then will go reach out to the contacts, then put people in quarantine based off of that. Again, if you work for a company and someone at your company tests positive of COVID-19, that does not mean you've had a direct contact. That does not mean you need to be in a quarantine. You're in a quarantine if we reach out to you. If there's a gap in our investigation, we will let the public know via press release. We'll talk about it at these briefings and ask for your help and your awareness. Certainly, we're making progress with the virus, but it's still here. We need you to be very diligent. Your health is your greatest asset. Take your temperature. Check your health. Be very conscious of your symptoms each and every day. We need you to be a great partner. You have been a great partner. That's why we're seeing the progress we're seeing. Related to social distancing, it's a technique, it's a mitigation tool. It works. It's been working. We have data to show it. It's worked with our COVID cases week over week. We've shown you cases related to influenza A and B when we implement social distancing, how those caseloads, other respiratory illness, goes down to the point where there were no cases for a week. So that's important to know. We had a voluntary shelter in place. It was voluntary. The government gave directives. We asked you to be part of our team in this struggle. Nothing has changed. All we're saying now is we believe that you know this fight is real, this virus is lethal. We have confidence that you now are going to help us and actually do more social distancing than you did last week. But you're going to do it on your own terms. We can't be here telling you what to do all the time. We know everybody's in on this. We're in this together. We know you're going to help us starve this virus. There's a lot of different data points coming out now showing that we're doing very well with this related to traveling and whatnot. So thank you for all your efforts. We need you to hunker down and stay in this fight with us. We're getting into the red zone. At this point, we start planning and preparing for our economy. We look at a restart. We've talked about a restart, but we talk about recovery. And at this time, I'd like Mayor Walsh to come up and talk about some of the efforts that are ongoing and thank him again for his leadership in this process. Mayor?
Thanks, County Executive. I was on a call earlier today with that County Executive McMahon pulled together with counties from around the region and cities from around the region, and it was even clearer to me that the County Executive has not only stepped up and led this county, he is leading this region through this crisis, and it's truly appreciated. As the County Executive mentioned, there is beginning to be discussion around what a restart looks like. And he has been clear that the public health data is going to drive that decision making. That said, we need to be preparing for what the economic recovery that follows that restart looks like. And as has often been the case with this community, while this virus has put us all on our heels in some ways, wherever possible, we've tried to be proactive. And that includes on economic recovery. So 1 month ago today, I was standing before you announcing the creation of our Economic Resiliency Task Force in partnership with the county, with Center State CEO, and with McMahon. And since that time, that task force has been working extremely hard, developing a series of recommendations that we discussed today. So the County Executive and I just left the virtual meeting of the task force where we went over many of the recommendations, and they've done really good work. And because of that work, when the data supports a restart, I believe that our community, our city, our county, and our region is going to be ahead of the game on that road back to economic recovery. As a reminder, the task force that we established is an 8-member task force representing private sector businesses and nonprofits. In addition to the task force itself, they established a number of working groups which represented governments, businesses, and nonprofits from 5 counties. So that included representatives from New York State Empire State Development, State Department of Labor, U.S. Small Business Administration, and organizations again from Oswego County, Madison County, Cortland County, Cayuga County, and the organizations that I mentioned previously. So a truly cross-sector, regional approach to recovery. Again, they met over the past month, established a number of recommendations, and I'm going to share some of those with you now. So overall, they have identified 35 specific recommendations in 4 different areas. I'll cover the 4 areas. First is optimizing existing programs and sources of support to businesses and nonprofits. So that's looking at existing resources and existing agencies that we typically look to for economic support. On the federal level, U.S. Small Business Administration, which we know has received additional support in the stimulus packages. The Regional Economic Development Councils on the state level. And locally here through our industrial development agencies and our economic development corporations. Examples of that include the SEDCO Emergency Loan Program as well as the county's Emergency Loan Program. Second category, assistance to employers to help them reopen safely and effectively. Again, there's no instruction manual for this, so we are all relying on each other to come up with the appropriate processes and protocols. The task force has spent a lot of time collecting and sharing best practices and developing a toolkit for employers, and that work will continue. Third area is a range of local, state, and federal policy recommendations to help businesses and nonprofits. And fourth, long-term resiliency strategy based on unique strengths of Syracuse and Central New York. So thinking about understanding that every community in the United States is looking towards this path of recovery. What are those areas that we have excelled and invested in prior to this crisis and will continue to after? Things like unmanned aerial systems, the Syracuse Surge Initiative. The importance of connectivity has been further evidenced throughout this crisis. Connecting with people virtually, remotely has never been more important, and that's the foundation of the Syracuse Surge strategy. And certainly healthcare and higher education anchors in our regional economy. I also mentioned at the beginning of the process, Center State CEO conducted a survey. We had more than 260 businesses respond. The results of that survey are on Center State CEO's website. No doubt about it, crippling economic impact on many businesses throughout the region. However, there were a few silver linings, a little bit of positive information. Among those, 20% of manufacturers reported an increase in demand that required hiring, and 10% of respondents overall are looking to hire to meet new demand. Again, that full report's on Center State CEO's website. I encourage people to take a look at it. That has really informed our strategy. As a reminder, the members of those task force, Nate Andrews from Morse Manufacturing, Calvin Corridors from Pathfinder Bank, Jeff Davis from Barclay Damon, Joanne Gagliano from EDR, also chair of the Regional Airport Authority, an important partner. David Hoyne from Kitty Hoynes, Evelyn Ingram from Wegmans, Jeff Knaus from Digital Hive, and Loretta Zolkowski from the Human Services Leadership Council. Also, I want to acknowledge the staff that has led this work on my team. Jen Tift, our Deputy Commissioner of Neighborhood and Business Development, along with Indaria Jones from her Business Development team, and Nora Spillane at Center State CEO, as well as the county executive staff, including Bob Petrovich. Going forward, the group will complete its recommendations, which will be prepared to share publicly in the coming days, and they will continue to provide assistance and support as needed, both to the county and the regional restart efforts that are underway. That's the report. Happy to answer questions, but in the meantime, I'll turn it back over to the county executive.
Thanks, Mayor, and all the work that's been done. It's really just amazing the way that our community has responded and the way that we have come together in so many different ways. So very proud of the work that everybody's been doing and these challenges. We're going to go over just some numbers real quick, then we'll take questions. Upstate Triage Hotline, 315-464-3979. This hotline is for our triage testing site. You may get referred via your primary care provider, or if you don't have health insurance, you call, you'll get screened, you set up a time to come down to the Syracuse Community Health Center to get tested for COVID-19. Our seniors, healthcare worker, and adult nutrition hotline, 315-218-1987. Again, this is we knew in the beginning of this process when we're doing continuity of food planning, continuity of care planning, that there are going to be people that have never needed help that need help. We create this line, we create the support staff through our volunteer networks led by Isabel Harris, and really have done amazing things getting food to seniors that didn't need food before. They need a meal, they need help getting groceries, first responders need help, toiletries or whatnot. The mayor mentioned new business opportunities. Certainly toilet paper is a new business opportunity for someone to further expand on that. And that's what this line does. If you call, you need help with somebody, reach out to us today. A food pantry is getting low. They called us, we got food to the food pantry. Child Care Solutions, 315-446-1220. Our continuity of care operation for essential businesses. This will be important in a restart. We'll need to be able to expand this, and we're already working on that type of plan. If you are an essential employee, you're running to child care gap, contact 315-446-1220. Social and emotional support, mental health. This is a real challenge. It's a public health issue. Please call 211. Talk to somebody that can help you with strategies, referrals. There is nothing to be ashamed of in this time of really unprecedented situation with this pandemic. Nobody's ever been through this before, and so it's important that we get the help we need so that we can stay healthy, especially if it's not just your health and it's your children's health. We need you to be strong and healthy for your children as well. Saying that, questions for myself, the mayor?
Both of you have indicated an interest in pushing ahead with the Syracuse STEAM School renovation and opening. Do you have any indication from the state, which is, hemorrhaging money and all this, that will have to be delayed or that can go ahead this year, and that the state will be there with the education money that's going to pay for it?
Yeah, my understanding is that what we're talking about for potential cuts from the state is kind of operating cuts, operating aid to municipalities. STEAM was a strategic initiative from a different pot of money, is my understanding. But Mayor, do you want to add into that?
Yeah, so it's important to keep in mind that the funding for the STEAM school, the state funding, comes in the form of debt service over a long period of time. So it doesn't require a big pot of upfront money. The county has offered from very early on in the process to advance the upfront financing of the school, and we are continuing to work in that direction. Obviously, the cuts that have been discussed certainly for the city of Syracuse would be devastating. State aid, if we were to lose 20% of state aid, that's another $14 to $15 million on top of at last count was probably $20 million that we're already anticipating this costing us in revenue. With the school district, 20% means about anywhere from $60 to $80 million, so it is significant. I think that if we end up there, we're going to have to rethink a lot of things. But as far as we're concerned, we are moving ahead with STEAM. We have had no indications from the state that their support has wavered at all. And in many ways, looking at what we're trying to accomplish with the STEAM school and preparing the workforce for the new economy, this crisis has shone light on the fact that we need to focus even more on that to make sure that we're in a position to grow and to be more resilient for future situations like this.
Just to be clear on the specifics of the different pots of money, the funding for a school would come from state bonds that are less vulnerable to the economic problem we're having right now.
Correct. Thanks.
Mayor, while you're at the podium, I know the governor has oversight on education and when schools can reopen, but I know you're going to address some of this, some education topics tomorrow. Do you foresee the school district opening again this year?
We're going to have the superintendent at our briefing tomorrow. We won't have, it's not likely that we'll have any specific updates around school reopening. The governor's made it clear that that's a conversation and a decision that needs to happen at the state level. And so we're working with the school district every day to make sure that we're providing our kids with what they need during this time when they're out of school. I do want to take both of these questions as an opportunity to just reinforce how important federal aid for state and local governments is. I was incredibly disappointed that it was not included in this recent stimulus package. Certainly we're happy that businesses are getting additional funding. They need it. Certainly we're happy that our hospitals are getting additional funding. They need it. But we need it too. Local government is a foundation of your community. We provide those basic essential services that we've talked so much about in recent weeks: police, fire, health department. Think about where we would be as a community if the county was not in the position to fund the health department the way they need to. That's what's on the line here. And to suggest that should not be up there as a priority with everything else that we've discussed I strongly disagree with.
So what are Senator Schumer, Senator Gillibrand, Congressman Katko telling you about why that money hasn't been included?
Well, I can say definitively Congressman Katko absolutely believes that state and local governments should receive funding and advocated aggressively for it during this last round, as did Senator Schumer, as did Senator Gillibrand. Our federal delegation has been steadfast in their efforts to support state and local government funding. Obviously, it was not the priority of everyone in Congress, and I think that's why you see you see the bill that's being voted on now. I have heard from the president, from Mnuchin, that state and local government funding is on the table, just not at this in this phase. So we are going to, we're going to try to hold them to that and hope to see it come shortly after.
And I just want to go back to something we were talking about a second ago. You don't foresee yourself shutting down the school district for the rest of the year. You would leave that up to the governor.
I would not make that decision.
Mayor Walsh, while we have you up there for reopening, you said that you'd be releasing 35 recommendations across 4 areas. I just want to reiterate these areas with you. You said existing support, assistance to employers, policy recommendations, and then long-term, correct?
Existing support among programs and at the federal, state, and local level, assistance to employers for restart, to reopen, state, local, federal policy recommendations, including what we just talked about in terms of advocating for stimulus funding, and then long-term resiliency strategy based on a sector-based approach.
And you mentioned that the recommendations would be completed in the coming days, but are you able to share with us, are there any that are already established that you'd be able to share with us?
Again, I wanted to cover the general areas in here. We'll provide the full recommendations, as soon as possible. Literally, the county executive and I were just sitting in on the meeting with the task force, so we want to make sure that they're all comfortable with the final recommendations before we make them public.
And with your communication with the county and the other counties, does it sound like you guys are coming to a date, a week, a month that would almost be good to restart, to begin that?
And I hand it back over to our fearless county and regional leader.
We're having great conversations, and if you can imagine all the feedback from the business community, we're lucky we've taken this team approach to economic development in our county with the mayor, myself, and McMahon, the regional council, Center State. So we work on a team on this stuff all the time. All the rest of the communities, that's not necessarily the way that business is done. So what we've done is we've gotten county leaders together. Counties have all the health departments responsible for the front line in this fight. We've gotten our cities, who represent the hearts and really the heart of the region's economic engines, together, so that everybody's comfortable. We're getting feedback in from business from every end of this. We've gotten that feedback in from our region, and now our health departments have all talked to each other. And we're working through a concept of a restart. Now our health departments are digesting that. They're going through various scenarios that they've seen in their investigation, and they're looking at this and making their recommendations for tweaks and for input. So we're doing all this. We're going to get back together tomorrow. We'll probably be back together on Saturday or Sunday as well, and then we'll have a plan for the state to consider. And there's the plan, which talks about phase 1, what that looks like, phase 2, and phase 3. But then the when, and the when is what triggers the plan. The when is the healthcare data, and we've talked a little bit about some of those driving factors. So really, it's the healthcare when is data driven. There's no political influence there from any level of government. That's just when this can happen, when these 5 things can happen and the health commissioners are comfortable, that's when this starts. The plan is what we need to agree at the local level with the input from all of our stakeholders, and then we need the governor's buy-in as well, so that the governor's comfortable with that. And then the governor may come back and give us feedback, say, really need to know more here, here, or here. Then we get back to the drawing board. But that's kind of how we envision this thing playing out.
So the health departments all cohesively come together, and then they kind of give you, the counties, the cities, a recommendation as to when they think you can roll out the phases, phase one?
Yeah, the data is going to drive that. So it's the health department will say this is what we're interested in seeing happen before the restart. And in a lot of this is, remember, this is all fluid. There's data coming in every day. There's trends that have been positive, but those trends could go the other way if we start easing up on social distancing. Right now, what's been driving a lot of our cases are these affiliated cases. These weren't driving our cases 2-3 weeks ago. Community spread was driving it. So if you remember when this all started, 50-50 travel-related, community spread. Some point somebody came in, got it here, community spread. Our first cases were community spread. We didn't know where, still probably don't know where, but we saw a lot of travel-related community spread. You change policies and social distancing policies, the traveling stops. You don't see traveling cases anymore. It's just been community spread. Now we're looking at it and we see affiliations. We've always had contacts along the line of household contacts that became positive. Now we see affiliations specifically in dense buildings, assisted living, independent living, and nursing homes.
And on that point, I mean, that's the reason you're seeing probably a higher percentage of positive results from the tests?
Yeah.
Yeah.
Yeah. And mind you, we're out there proactively testing these people. So we're legitimizing positives that probably would have gone their way and nobody would have ever known about. We've had asymptomatic people here that we've been able to identify, quarantine, save other spread, save lives. So we look at the numbers. The numbers are still 29. If you just look at 29 cases, geez, that's a big number compared to where you were. Well, for us, we're excited because we have 12 contacts, right? 12's a little bit lower than the average for the week. And we've identified all these other people that we probably wouldn't have known had it. And now we're going to be able to get them help, and we're going to be able to prevent further spread, and we're going to save lives by doing the proactive testing. So we're excited with the numbers.
On the task force, you mentioned you're meeting Saturday, Sunday, and then you'll have a plan. Did you just not list the other days, or do you mean you'll meet Sunday and then Monday have a plan?
It's all fluid, Andrew. We don't have schedules. Everybody is working. So every other county leader does the same thing I do every day. It's just a different magnitude depending on how big their county is. The other mayors are doing the same thing the mayor does every day. You have a huge operation to run. You got challenges. So we're putting together a meeting with 11 elected leaders or 12 elected leaders, whatever it is not the easiest thing to do. So that's fluid. We're going to at least have 2 more conversations together before anything's submitted to the governor.
You mentioned the third part of the restart phase is presenting it to the state. When you do that, what are you hoping their input will be in their role in the rephase of the reopening of the region?
Well, to be clear, if the data shows that anything before a May 15th start is appropriate, the healthcare data, we need the governor to say, I agree. He has that power. So if we all agree that, okay, the 5 metrics have been met, the day is before May 15th, we agree to that. He still needs to agree to that. So certainly we want to have a very comprehensive, well thought out plan. I think if you look at I wanted to share with you a couple data points. Mind you, this is earlier in the week, but all this data was early in the week for every region, okay? Capital District, 1852 cases, okay? Finger Lakes, 1523 cases. Long Island, 60,000 cases. Mid-Hudson, 46,000 cases. New York City, 142,000 cases. Central, 742 cases. We are doing pretty good. And we got together early. We had a team approach early with our government in Central New York, our hospitals, our healthcare providers. We planned. We implemented mitigation tactics and techniques before this really got going. And you can see the results because we had time to learn from these other communities what was happening there. So we think the data merits us having this conversation and putting the plan together. The triggers are the triggers, the triggers will set it off. But the governor, anything before the governor's date, the governor needs to sign off on.
Would you go through some numbers for me, even if we run through these quickly? How many places have you done proactive testing? You mentioned about 6 hotspot type residences yesterday. Have you gone to all 6 of these places to do this proactive testing?
I think so, Andrew. I think we're well beyond that process now. Remember, we have nursing home employees going to one site. We have offered to do nursing home employees at other sites as well. The state has done testing in nursing homes. Assisted living facilities, we have done testing on residents and employees. Independent living facilities, we have done testing on residents and employees. Our focus of where was driven by past positives, because that's where you'll most likely find asymptomatic individuals and other symptomatic individuals. We aren't stopping there, we're moving on. If we still have resources after that, we could go into testing in other dense buildings where you see density. We could do testing with health aides who are in and out of housing. So we're going to continue to do proactive testing so that we can find the virus if it's sitting somewhere asymptomatic, so we can stop potential spread.
Are you testing hundreds of people in total at these locations?
Yesterday we tested, mind you, you had Walmart with 383 tests over the week. Yesterday we had 159 tests yesterday. So we got a lot back. 212 tests back yesterday. The day before we got a lot of tests back. So we went into some hot spots. We knew we'd find some positives. We found a bunch of positives today. Now we know, if you look at the 2-week lag, in 2 weeks from now, we're hopefully going to have all these people better, and all their quarantines hopefully will be in a position to be released. And because many of these weren't community spread, in theory, we won't see those numbers again, right? We won't see these hot spots again. We've identified them all in our community. We're proactively testing so that in 2 weeks, that problem's off the table. What's left is what the real community spread is. How do we fight that? We social distance, and social distancing will be the norm in any phase in as well. Businesses will need to social distance. This will not stop. This is a mitigation technique that will be with us until this virus is gone.
The county has not tested residents of nursing homes, right?
No.
Because that's state regulated.
Correct.
Okay.
The state of New York is in charge of nursing homes.
But you have done
They've
some
made-
proactive employees of nursing homes.
Correct.
But the county is doing assisted living and senior independent living.
Yes.
Ryan, can I just follow up on that? I mean, the testing at these senior living facilities is voluntary. Why doesn't the county offer voluntary testing of nursing home residents? Is that not working?
We've been talking with the state of New York, and the state of New York is in charge of nursing homes. They've made that very clear. We're going to honor their wish, and we'll stay in our lane. We are here to help when they need our help, if they need it.
They haven't asked for it.
No, they talk to us every day. We let them know what we're doing. We let them know we're concerned, because we talk to our nursing homes, of course. We know these people. But from a standpoint of testing residents, the state of New York is the regulatory arm over these private businesses. And the private businesses are private businesses. They know the rules. They know who they report to. And so that's where that lies. The state of New York is going to make the decision about testing residents in nursing homes.
In your discussions with the nursing homes, are they satisfied that they're able to get testing when they think they need it?
I don't think it's been an issue where I don't think there's been anybody asking for testing and it hasn't happened. That I think that is not a problem. If anything, it would be the other way around for a period of time. But right now, The good news is there are nursing home residents being tested. The state of New York's testing them. We've offered testing to employees. So we're getting our hands around when there is a problem, and we're getting out in front of potential problems due to the density and the nature of these facilities.
Where the county does have jurisdiction, why not name the facilities?
We're not going to highlight any facilities, Andrew. People have it goes to trying to figure out who could be tested, who could be positive. Some of these facilities have 15 people living in there. That's 15 doors. You can try to figure out who it is. So that's really into the HIPAA. I get some of them are bigger, but into the HIPAA issues. We want to the best way to figure out if they've been tested is because we're telling you we want to test them all. And so we want to test everybody who lives there and everybody who works there. And most of them are working with us. It's in their interest to work with us.
Do you think it's realistic for Central New York to get to a restart before that May 15th date? Because if you don't submit something to the governor until next week, May 15th is 2.5 weeks from then, and you're saying there's a 2-week lag in the testing.
Yeah.
Do
Well,
you
the
think
result.
that's possible?
Yeah, I think it's possible. The results are there's a lag in getting people off of quarantine for 2 weeks, and at least 7 days to get people healed. We're getting real-time testing back now, so each day we get back more results than were pending the day before. So our ability to fight the virus in real time is there now. That's not one of the challenges when we look at one of our triggers. Certainly, we like to see more data. Certainly, we want to see PPE get a little bit better. But when you look at hospital capacity and you look at rapid testing capability, turn time testing capability, our tracking teams, we're good there. That's not what's holding us back. And so there's other health metrics that we're not quite there yet, but that's getting ahead of ourselves. We could be there, in our opinion. If the governor's not comfortable, the restart happens on their timeline.
In talking about the regional approach to restarting the economy, the governor mentioned today that it makes sense, and yet we're part of a wider region where there are New York City and Boston and Philadelphia, places that have high concentrations of COVID. And if we open before they do, and if people start coming here to go fishing or go to the mall, or is there a danger of having more travel cases come in and spike us up?
There's risk in everything. I think it would be a tough argument for the community in this region to make the argument that with 742 cases, and on the same day, New York City had 140,000 cases, we're in the same situation. Now, the risk being for a business, in any restart plan, the business is given guidelines on what they should do and how they should interact with customers. Many of these businesses, you're talking about appointment-only scenarios for a while. Certainly, areas with large gatherings will be phased in on the back end of a restart plan. But buying a car, for example, you can buy a car online right now anywhere. So would some people come here to buy a car? Maybe. In the guidelines, was it the person would need a mask? Yes. In the guidelines, does it suggest temperature taking? Yes. So if these things can be done safely, that's what the business community is going to have to work with in these guidelines. But there's risk in everything. And COVID's here. And the only way it's not going to be here is if it leaves really by itself. At some point, we'll have antiviral ways to treat it. And at some point, we'll have a vaccine, but it will still be here. So how do we fight it? We fight it with our team in real time, and we isolate it quickly, and we're constantly looking for it. and to identify it. And that's the reality. So if we're waiting for COVID to leave, restart and economic recovery are impossible at any time this year.
Ryan, I'm sorry.
Yeah.
I'm not sure if you realize it, but I'm impressed with the poetic nature of it. You and Mayor Walsh shared a podium 1 year ago today in the Carnegie Building to talk about the DEIS released by the DOT on Interstate 81. I was also on the other side of the podium asking questions, so it's a nice reunion.
Okay.
What's the status of I-81 in general? What's the impact of coronavirus on the I-81 project?
Yeah, I'll let the mayor talk about this a little bit. I don't know. We've been so inundated with the public health aspect. Certainly, if you had stimulus funding that it was driving infrastructure, that's a big infrastructure project. So I don't know that really this is on anyone's radar that much, but I'll let the mayor touch on that as well.
Not too much to add other than, when you think about economic recovery, I can think of only one $2 billion project in this community, and that's 81. So as we talk again about stimulus, you all know what's number one on my priority list for what we hope is the next phase. But it sounds like it's likely that infrastructure projects are also going to be included within that phase, which is something we would certainly support. We have a number of projects, and we're in the process of collecting them and prioritizing them in the city, in the county, in the region. But there's none more significant than 81. And so we're in the process of reaching out to the state to re-engage in that conversation, but we're going to push hard for it.
Do you get regular updates from the DOT on where their work is?
We, up until this crisis, yes. Over the past month, I think we've all been distracted, but as we start to look at recovery, I know my staff has recently reached out to DOT to re-engage in those conversations and to hopefully tee that project up to benefit from any future infrastructure investment.
Will you still be mayor when it's finished?
Let's hope so, Andrew. Thanks.
Any other questions?
Speaking of businesses that are closed, a lot of people are concerned about haircuts.
Oh. No kidding.
What have you been doing? Has Justin been cutting your hair?
No, so it's funny. I forgot what article it was, but someone suggested that I've been getting haircuts. Now, I could make that suggestion about others at times where it looks like maybe they've gotten a haircut. I can assure you I haven't gotten a haircut. I'm not going to give out all my trademark secrets today related to hair product, but certainly a good way as your hair gets more unruly is when you get out of the shower, just load it with hairspray and brush it immediately. That's one of my secrets right now. But I'm very concerned about haircuts overall. My son Andrew has what we now call helmet head, where it's like a football helmet of hair. But that's one of the sacrifices, in all seriousness, we're going through right now. And that barbershops, salons, this has all got to be part of a restart plan, and it's got to be well thought out. And our health departments are looking at this because of the close contact people have. So something as simple as a haircut, it will take our haircuts, the mayor and I's used to be about 5-10 minutes each. Now it'll be about 20 minutes each when this is all done. But that's a serious consideration our health departments are looking at. Justin needs a haircut. If you haven't seen Justin's hair, he needs a haircut big time.
Brian, has Dr. Gupta had a chance to look at the state DOH survey on results on antibody testing? I guess it suggested that Upstate, on average, might have a 3.6%
Right.
infection rate. Does that make sense?
I met with Dr. Gupta before this briefing, going over a lot of things. We briefly touched on that. Certainly, as somebody who's been engaged, it makes more sense that you'd see more antibodies in Westchester and Long Island and New York, where they have absolute community spread. Here we haven't. We've done well. So I'd be curious if our numbers are even less than the 3% that Upstate overall has to see what the antibodies suggest. But we have not spoken directly about if she's gotten direct data related to our county. Certainly we have discussions about how that testing could be used as a tool in the future, and what value those types of tests present in the future as technology improves. Other questions? Certainly, I know yesterday, as many of you know, was Administrative Professionals Day. I want to give a big shout out to our administrators in our office, Eloise and Pam and Tina, and our birthday girl in our office today, Gina Giblin. These folks have been on the front lines of all your phone calls. And I got a taste of one of those phone calls today. There's a gentleman who called. He was very passionate. And he went on for about 20 minutes of speaking, and then he just hung up. So these folks have been there to help people get answers throughout this process. Their roles have increased in part of this response, so I want to recognize all the administrative professionals throughout the community, specifically ours, and I know the mayor has recognized his as well. So thank you all, and let's be smart, stay strong, and be safe.